Everybody. We're going to get going in about 4 minutes. I'm Sue Hitzman. I'm the creator of the Melt Method. Welcome to our session on knee pain. If you want, go ahead and click on the chat box. Let us know where you're from. And if you have any initial thoughts or questions about knee pain, definitely leave them in the comments. And we'll, like I said, get going in 4 minutes. Make sure that you have some water nearby. If you have the Melt products, what I'm going to be using is the Melt Soft Body Roller, but in one of the lengthening techniques, depending upon how severe your knee issues are, you could be using the Melt Half Roller when we do some of the lengthening techniques I'm going to demonstrate for you. And I'm also going to be using the Melt Resistant Band so that we can really perfect one of the lengthening techniques called hip to heel press, rotate, and cross. I'm going to see if anything comes up on our feed so that I know you guys can hear me. Hopefully you can. Let me look. I don't see anything. Yeah, maybe give me another thumbs up there if you guys are hearing me. Maybe like hit your thumb, I don't know what that is, or if anybody is here, maybe you could just type in I hear you, just making sure that you do. Yes, thank you. Excellent. Excellent. Let's see what happens. Hang on a second. I actually think I'm going to get my other mics. I'm going to swap out my recorder here, so let's see if this changes. Let me know if you... Can you hear me now? Let me know that you can still hear me. Say, yes, I still hear you. This didn't look like it had enough juice in it. I don't want to lose audio halfway through. This is an important topic. Oh, yes, my little yoga cat. Okay, thank you. I'm glad you guys can still hear me. Thank you very much. I hope you guys have some water nearby. Hello and greetings and welcome to everybody. Perfect. I'm glad you guys can all still hear me. Excellent. I love it. All right. As long as I don't need to read anything just yet. I'm going to set those glasses aside. We're going to get going in 60 seconds. Again, if you guys have any specific questions about your own knee pain, or there's something in particular that strikes you or strikes a chord as we're talking, just go ahead and leave the comment in the chat box. I've got Carrie here, who's one of our Melt Master trainers, who's here to answer some questions, as well as Rebecca and Noelle. And we'll see how much we can accomplish in an hour to refine a few techniques for you and get you thinking out of the box about your knees. Okay, so if you're all ready, I'm going to take a sip of water and then let's get going. Okay, so welcome everybody. I'm Sue Hitzman. I'm the creator of the Melt Method. I'm a manual therapist and my background is in neuromuscular therapy. And today we are talking about knee pain. Quick story, I have, knees are very important to me. When I was in 8th grade, I remember messing up my knee playing a game of tag. My friend Steve pushed me while I was in midair, came crashing down on my knee, and went and had all of this liquid, all this interstitial fluid drained out of my knee, wore a splint for 5 weeks, and then I was back out playing around. Played a ton of soccer, was quite a bit of an athlete in my high school days, and just continuously was hyperextending my knees. And then I was spraining my ankle a lot, and I didn't really make the correlation of what was going on. I mean, nobody was pointing anything out to me at that age. But jump ahead, I'm 23 years old, washing my hair, and my knee keeps buckling out from underneath me. And I would just even jump up onto a curb or up onto the sidewalk or back down to the ground, and wow, my knee was just killing me. So I finally got an MRI, and they showed 2 tears in my medial meniscus and a cross tear in my lateral meniscus, and the surgeon said to me, this is really bad. This is not fixable. We're going to have to remove the meniscus so that so the joint will work again. And I said to him, oh, I think I'll keep it. And he said, well, you can't keep it. You're going to, it's never going to repair. And I said, well, it's my meniscus, so I'm pretty sure I can keep it. And I wrote a story of this in the Melt Performance book, that this doctor sort of said to me, if you don't get this surgery, you're going to be crippled by the time you're 30. And I said to him, well, my mom had knee surgery when she was a kid, and she said it was the worst thing of her life, and it really ruined a lot of her athleticism. And I don't want to be anything like my mom, so I'm going to keep my meniscus. Thank you very much for letting me know what's wrong. And I proceeded to leave this surgeon's office. And I was very lucky to have Jim and Phil Wharton, who did active isolated stretching. I showed them the MRI report, and they said, hey, what I see is a lot of hip instability. And I was like, instability? I'm an athlete. How can I be unstable? And there was my first introduction to breaking down some ideas about this joint and understanding the importance of the knee, and then going on to neuromuscular therapy with Leon Chaitow, and I've never looked back. And I'm 50, going on 52 here, and my knees are fine. They don't crack or crunch. And I used to have knees where if I squatted down, it sounded like popcorn coming out of my knee, right? And again, a lot of pain. But once I got a handle on understanding the knee joint, it really was quite fascinating to understand that although this joint has this movement, it also has a rotational component when the knee is bent. And for a lot of people who have knee pain, there's a lot of things to consider. So I'm just going to give you a little idea about your knees to maybe have you think a little bit out of the box about this joint. And then I want to give you a couple of techniques from Melt. And for those of you guys who are new to Melt, you can go to meltmethod.com. You can find out all about the methodology. I have a streaming platform, and actually on that streaming platform is the Melt Knee Pain Collection. So there isn't just one Melt map or one technique that you can do to work on your knees. There's actually a collection of different things that you want to consider, okay? So again, you can go to meltmethod.com and make sure on this page, if you haven't subscribed to this channel, make sure that you subscribe with that button below and become a part of this, because I do these kind of talks every week now for you guys, and there's lots more to come on Melt Method. Okay, so a couple of things about your knee. Did you know that this is the largest joint in your body? Is the largest joint in the entire human body. And what I can tell you about connective tissue, and if those of you who know about Melt, Melt is all about restoring the fluid components of fascia. And if you think of the fluids in fascia kind of like a river, daily living lays down a bit of sediment that alters the river's flow. And even if you don't have joint pain, I'll guarantee you felt the breakdown of this fluid component, like when you sit for long periods of time and when you get up, you feel like you aged about 40 years because your joints don't work as well when you get up as they do when you sit down. If you felt that and you get up and you move around and that ache or stiffness in your joints goes away, we just think it's normal, right? It's a part of regular life. But it just is not normal. It's just average. And the problem with that stiffness is that although the stiff feeling might go away, the issues in the connective tissue remain. And where the sediment really loves to exist in our body is in spaces. And the two primary spaces of our body, our neck and our low back, are obviously culprits of pain. A lot of people have neck and low back issues. But again, the knee is the third component. Your knee is also a very forward moving joint. It's what moves us forward in life. And so if you have any type of emotional stress where maybe you're worried about your finances or your future, you're not really sure, should I be getting married? Is this the right person for me? Is this the right job I should take? Whatever that is, that kind of stunts you in that forward motion. Oftentimes I find with my clients who have that fear or worry about the future, their knees will start to hurt. So if you have bilateral knee pain, I would be looking at a number of things. Number one is a toxin relationship from your diet. I would be thinking of your emotional balance and the overall mobility that you do. Because of course, when our knees hurt us, what do? We sit down. And that's a problem, because the more we sit down, the more we're altering the fluid component of this joint, so that when we get up, it's not really prepared to propel us forward. And again, it accumulates a lot of imbalances in the knee. Okay, so just things to think about. Now, if you actually injured your knee, you actually fell on your knee like I did, you cracked your kneecap, you have an ACL repair, an MCL repair, whatever it is, that there's a thing that's actually wrong. But that does not mean that your knee has to have pain, okay? So again, all these things to consider. So if we have hormonal imbalances, you're going through menopause, the estrogen changes, the fatty pad in your knee is going to get affected. There's a bone called the patella. It needs to glide over the knee joint itself, and that fatty pad is very, very important to that glidability. So a lot of women who have menopause also complain about knee pain. So again, why would we want to know more about knees? These all seem like reasons. In evaluating people's knees in the years that I've done this, I find a lot of people actually cannot straighten their knee fully, and they have no idea that they can't. So we're going to evaluate your potential to bend and straighten your knee properly and the range of motion of the knee. So we're going to take a look at that today. The last thing I want to talk about before we actually get into techniques is that the knee is a segue. It's a middle joint. So the knee is really not the problem. What is oftentimes the problem is your footing, your ankle mobility, the movement of the ankle. If your ankle can't dorsal and plantar flex, every time your heel strikes, as that leg moves over the ankle mortise and it rolls over the ankle joint, your knee is going to be the thing that's going to pay the price if that movement of the ankle isn't solid. And of course, what's up above our knee is our pelvis. And so all of the instability from the volume of time we spend sitting to the imbalances that occur in our pelvic positioning, from being right side dominant, those of you who are maybe runners, or you're playing martial arts, or you are playing basketball, we have things that we tend to get dominant to one side. So our pelvis will also cause some mishaps in the knee alignment. Last but not least, what about thoracic rotation? When we walk or run, our knee is going to be very affected by the rotational components of our ribs. So in the Melt for Knee Pain collection that we have on Melt on Demand, there are many videos that address every single facet of these things to consider, and then how to mitigate that and reduce the chances of all of the accumulative stress that ultimately will alter the knee stability. So today, I want to go through a few really integral techniques and concepts to refine your practice and get you thinking about how can I help myself in a simple way, a few minutes a day, to just begin to introduce better hydration and better stability so that my knee can track properly, okay? So the first thing we're going to talk about is, can you straighten out your knee all the way? Well, there's a couple of ways to tell. And just in a resting position, can we tell? So we're going to do two quick assessments. The first one is just a quick rest assess. And what I want to draw your attention to, if you lie on your back with your palms faced up with me, just go ahead and rest on down onto the floor. If you bring your palms faced up, what I want you to do is, instead of fidgeting or adjusting, just kind of think of this as like taking a selfie. So I just want you to rest still. And what I want you to notice are the areas of your body on and off the floor. Okay? So just start to use body sense and just notice your head, your ribs, your pelvis, the back of your thigh, the back of your calves, your knee or your ankle or your calves, and then your heels. Just notice the areas of your body touching the ground, and then tune into the spaces, your neck, your low back. There's a little space where your legs begin called the gluteal fold. Maybe you feel that, maybe you don't. Your knee space, your ankle space, just kind of key into these areas. There's 4 common imbalances that will really affect the mobility of you in any forward motion as we move through the sagittal plane. So the first is, as you're lying there, do you feel a lot of back weight up on the shoulder blades, but very little back weight in the midrib wall? If you're really feeling a lot of lifted presentation of the ribs, where you feel the arch of the back feels very extreme, I would make a note of that, because this is, again, part of the rooted core. It's part of what will help to stabilize our knee, is this neuromyofascial channel that attaches our spine to our legs. So you want to notice if you have this high tensional lift in your mid-back. Next thing I want you to notice is in your pelvis. Are you feeling evenly weighted on 2 butt cheeks, or do you feel your tailbone is very pronounced to the ground? Or for those of you who have knee pain, do you feel like one butt cheek is kind of more flaccid, more dropped to the ground, and the other one not? So if you feel very tipped to one side, make a note of that. And then I also want you to notice the back of the thighs. This is the really important one. Do the back of your thighs feel on or off the floor? And if you're saying, I think they're off, we definitely want to begin to approach the body in a way to restore the alignment through this neural core so that we have better communication as this communication passes through our pelvis and into our legs, or from our feet up to our torso as we walk, okay? So again, if you feel a lot of lift in the back of the leg, just go ahead and notice that. All right, so now roll onto your side, come on up to sitting. Second thing I want you to do, and this you can do with a full roller. I just happen to have the performance roller a little closer, so I'm going to go ahead and use this one. So I'm going to put my ankle on the roller, and what I want to do is put my hand behind my knee, and I want to try to straighten out my knee, and I want to see, does my knee go fully straight? And you can even take your fingers on the side of your knee and just push down on it a little bit, and can you straighten out your knee without pain? Right? So a lot of times when I'm looking at a client, when they go to straighten out their leg, their toes are pointed down. So if I have tension in my back line, I'm losing space, and so my foot will constantly drop. So I want to see if you can keep your toes dorsiflexed and try to straighten out the knee. And just notice the range of motion that you have. And then try it on the other side. Now some of you guys might also notice that as you do this, your toe, your big toe is projected towards your knee, but your pinky toe is kind of dropped away. And I want you to notice that as well. I don't know if you could see that better if I were to like kind of turn my foot this way as I'm straightening it. And you're seeing that that pinky toe is sort of away from the ankle. Try to get your pinky toe to aim toward the knee. And again, can you straighten out your knee fully? And just notice, does one knee seem to have a better range of motion than the other? Do you have restrictions in the ability to extend your knee? And if the answer is yes, we've got a technique that we are going to do called hip to heel press, and we're even going to add a move called rotate and cross, okay? So before we do those, I want to talk about a technique called calf gliding and shearing, and I want to really perfect this, because if you feel like your knee does not straighten down fully, I really want you to understand that a lot of that problem is originating in the calf, and it's originating in your ankle. Of course, the foot treatment is like 100% you'd want to work on your feet. I'm going to go ahead and bring this over with me so that you can really see what I'm doing here. But what I want you to do is learn how to do proper calf gliding and shearing, okay? So go ahead and put your calf onto the roller. Now, when we do calf gliding and shearing, correctly, we actually lie down, and you could use bolsters, but just to demonstrate this, I want you to really learn how to get something out of working on your calf. So I'm just going to go ahead and put one calf on the roller, and I'm going to keep my ankle fully relaxed, and I just have the roller, let's come up into the belly. Okay, so if you take your hand behind your knee and then go another hand distance, the roller should be about hand distance away from your knee. Can you get yourself there? Okay, and then once you're there, keep your ankle relaxed, and all I want you to do is bend your knee and stop, okay? What is important when you're doing these 3 compression techniques, I'm going to teach you gliding, shearing, and rinsing. Gliding, when you bend your knee, I want you to feel that right now what you're doing is gently compressing your calf into the curved side of the roller. And whatever the pressure is that you're actively participating in holding this position, as you straighten your leg out, I want you to feel how the pressure just came to the top of the roller. I don't want it to change in the pressure that you're creating. So I'm going to try to keep that pressure constant. I'm going to bend my knee. My pressure is a little more to the curved side of the top of the roller. And then as I straighten it out, it comes to the top of the roller. Okay, so I'm bending and straightening. So when you do gliding, the thing I want you to remember is that you are not rolling the calf. You see a lot of people telling you to do things like this, and this is just doing absolutely nothing for you except maybe making you feel like you're doing something, but really there's no tissue change that you'll get, and you'll get no neural change, which is really the important thing. So again, as I'm gliding here, if I want to really make more of an impact, what I'm going to do is I'm going to use the opposite leg, and I'm just going to cross it over my ankle. And I'm going to bend my knee again, and I'm going to notice how the weight of my leg just increased that pressure by probably 50%. And as I straighten it out, it's going to help me to maintain consistency. So as I bend and straighten my knee, I'm looking for consistent pressure, and what I want you to see is we're not rolling the roller, we're almost kind of carving out a groove, right? So I'm actually gliding on a surface that is about the size of the heel of my hand. That's how big a glide is anywhere that we're going to work in the body, and today we're going to really refine our practice of calf and the back of and the inner thigh. Okay, now once you get your glide going and you learn how to do it, the secret of this one is to keep your pressure constant, turn your calf a little inward, and keep going with the gliding. And again, all you're doing is just subtly bending your knee, getting the pressure to the curved side of the roller, straightening your knee, and coming back out. Okay, ankles staying relaxed throughout. And then come back to the middle, and then turn your calf over to the other side. So what gliding is here to do is to both prepare your connective tissue and the sensory nerves that live in it for the next technique called shearing. But more than that, it's a way for you to explore your tissue for areas that feel sensitive. So you're going to do it one more time. You're going to turn your calf inward. You're going to notice, what does it feel like here? You're going to come back to the middle. Notice what it feels like there. And then come to the outside and notice what it feels like there. Now, if there's a region here that feels more sensitive to you, I have one. It's more when I turn my calf inward on this calf. I'm not going to go over, like if you think of the areas of tenderness, we call those barriers, kind of like sediment in a river. Don't keep raking over the tender spot like you're going to eradicate a bubble that's in you. Instead, almost feel like you're going around it, or maybe you're staying just to the top of it, or maybe you're coming just off to the side of it, all right? But what you're doing is what we call meeting the barrier. And once you meet your barrier, you're going to pause, maintain your pressure, and very slowly begin to flex and point your ankle. This is called an indirect shear. Shearing is compressing fascia and the bones and the muscles that are kind of sandwiched in these layers. And as you contract the muscle, you're creating a shear effect, a gliding or sliding against fascial layers as the muscle contracts and releases. I could also make U-shaped motions as I do that. They don't need to be big. Or I can keep my ankle relaxed and I could slightly roll my leg left to right. That's a direct shear. I'm directly influencing the tissue from my skin to my bones with a motion. And if you feel like you're going over a bunch of Twizzlers or you got like a big speed bump going on here, maybe find the area that was tender, nuzzle up against it, and instead of rolling, you're kind of twisting the flesh. So you're pinning the skin and creating a shear on the underlying plane, right? I'm not rubbing my hand up against my forearm right now. I'm pinning the skin and I'm dragging the underlying substances against the bone. So I want you to almost think like you're using your own bone as a rolling pin. And then you're just going to wait there for a second. Give the tissue a moment to adapt. And then we're going to go over to the other side. Okay, so again, I'm going to find a spot I want to work on. Okay, I'm just going to bring this over so you can see this. So again, I'm not behind my knee. I'm not one hand distance. I'm kind of 2 hand distance south. I could come up a little bit higher, but we're just picking a good area to work on. And same thing, I'm going to cross my ankle over. If this was too intense for you, just keep your leg down. You don't need to do it that way. Just remember that as you bend your knee, pressure's on the curved side of the roller at the top. As you straighten, it's more top of the roller. Okay, so I'm going to bend and I'm going to straighten. Again, the really big secrets on this one to get the most out of this move is keeping your ankle relaxed and trying to keep your pressure constant in a small local region about the width of your hand. Once you get the movement going, you're going to, again, turn the calf a little inward. Notice what it feels like on the inside of your calf. Come back to the middle, and then come to the outside of your calf. So again, use your glide as a way to explore your tissue for areas that feel tender, sensitive, lumpy, texturized, whatever the word is you want to use. I've got one on this side, on the outside of my calf. This one was more inside of my calf. This one's outside of my calf. I feel like I have like an alien head living in here. I went running the other day. So, okay, so again, I've met my barrier. I am not going over it. Instead, I kind of found where it was. I find that sensitive spot. I get smaller and smaller in my glide, almost like I'm doing a little sneak attack to it. I'm staying just above where it feels most sensitive. I meet that barrier. And then again, nice and slowly, I just gently flex and point my ankle. It doesn't need to be big. I don't need to point my toes down so much that I get a calf cramp or get a foot cramp. I can make U-shaped motions with my foot. I could also keep my ankle relaxed and I could roll my leg a little left and right. Or I could pin the skin and drag it. So simple, right? And then we just wait here for a second. And then you would just pick another spot. You would work your leg down a little bit and you would repeat it. Now, I do want to try this one more time, but I want to try it in the proper position. So what I like to do is I call it melt movie night. So these to me are the brainless things that you can do to really help your body out at the end of the day when you're just watching brainless television, right? When you don't really have to think too much, here's a great way to do it. So I take my half roller and I use it as a pillow. You could also just use pillows, I don't care. But I'm gonna go ahead, I'm gonna move my roller down just a little bit. I'm going to cross my other ankle over, and again, I'm going to bend my knee. I'm going to find the pressure on the curved side of the roller, and I'm going to straighten out my leg. Now, if you have vertigo or anything where you don't like being fully down, I'm not saying that you couldn't have yourself up in this and have a pile of pillows on the angle, but what I want you to do when you're working on your calf, here's the secret, is don't get into hip flexion, because what am I doing if I flex? We have something called the superficial back line. It's a connective tissue layer that's attaching your foot all the way up through your legs, coming up through your spine and attaching to your brow fascia. So if I sit up, I'm causing tension to a thing I'm trying to compress and penetrate, right? So I'm actually getting less deep by being upright. I'm actually going to get deeper into the tissue. I'm going to match the bone compression if I just rest my head down. And same thing, I would do the gliding to explore, turning my calf inward or outward, noticing for sensitivity, noticing for tenderness, noticing for lumpiness. Again, if I find a spot that feels a little tender, I've got one, maybe just a little tender here, I'm gonna get smaller and smaller. What if I was gliding and I didn't feel tender? I would just move on to another spot, right? I don't need to shear every area of my body, but if I'm feeling something that feels sensitive, lumpy, tender, not good, I want to take some time and shear it. I want to pull fluids under the areas that have gotten a bit stiff and see if I can get the glideability. So this is really going to minimize any type of ankle issues also, okay? So again, I meet my barrier, I flex and extend my ankle a few times. I could make U-shaped motions. I could roll my leg a little left to right. Or again, I could pin the skin and just drag it a little bit left, right, especially in the lower calf. If you're so stiff in the Achilles tendon, it actually feels like a guitar string, a really thick, fat guitar string. Doing cross friction and just making it a smaller motion where you're just dragging, doesn't need to be fast, right? You're not trying to, put two pieces of wood together and make fire. You're just pulling and dragging the tissue against the underlying substances, and then you wait. Okay? And then you're going to do the same thing on the other side. Now, there's other techniques like rinsing that you can do to draw the fluid flow up to the knee and up to the pelvis and even into your torso. But again, let's just really focus on some of the key integral techniques, because today, instead of doing the rinsing, we're going to do a lengthening technique and really refine your practice of hip to heel press, another really key move for people who have knee issues. Okay? So again, I'm finding my barrier, still over on this lateral side on this side. I'm going to do the same thing. So for me, right now I'm making some inquiries. My brain, I'm saying, this whole left lateral border of my calf is a little sticky today. And I think to myself, maybe when I was running, there was something going on in my right hip. Maybe my right hip was a little stiff, not allowing for my leg to move properly on the left side. If I don't address this over time, this could cause me knee pain. So again, I'm going to try to get rid of it. Again, I could do my direct shear, rolling. But again, if that doesn't feel so great, I'm just going to pin the skin and just drag the flesh left to right. And then I'm just going to wait there, right? So think of a shear like working fluid into a sponge. Then once the sponge is hydrated, I compress, I wait for a second, and then I let it go so that I can get this fill effect. Okay, so that's calf gliding and shearing. So really work on that one. And again, that one is in a number of the videos from that collection. All right, so now let's talk about inner thigh gliding and shearing and see if we can perfect this one with you. Okay, so I'm going to lie perfectly on my side. I'm going to go into a perfect side lying pose. Once I'm here, especially if you have knee pain, I would like for you to take your roller, instead of being parallel to you, and almost make it perpendicular. Do you see what I'm doing? I'm angling it away from me. Once you're there, without falling forward with your torso, you're going to bring the side of your knee on top of the roller. And once you get it there, look at the angle of your leg and look at the angle of your roller. And what you're looking for is to make a cross out of it. So I look right now and I'm saying, I don't quite have a cross. I've got to bring mine up a little bit, or I would have had to have changed my leg angle. So what I'm doing is I'm looking at my thigh, I'm looking at the roller, and I want to make a T. I want to make a cross. Once I'm here, my toes are going to stay on the ground, and I'm going to allow my body to fall forward. And once I do, I'm going to stop. Because what I want to feel here is that as I've brought my body forward, that what I'm doing is compressing my thigh right on top of the roller. And take a look at how my knee is soft. Get your knee soft. I still have my toes on the ground, and I'm going to use my foot to push myself part of the way back. But as I do, I'm going to think about pressing my thigh into more the curved side of the roller. Okay? So this is what it's going to look like. I go top of the roller as I go forward. I come back and I'm more curved side of the roller, on the foot side of the roller. So I'm top of the roller as I go forward. I'm trying to maintain compression as I come back. So some images here. I think of a violinist where they take their bow and they sort of bow it over the string. So if this is a string, I'm taking my bow and I am playing like violin. I'm going straight out and then curving over the roller, right? So I'm pulling it in and out. Now start taking a look at your knee. Look at how close I am to that knee joint. I am just above my knee. I'm right here on this, just above my knee by an inch. And really get the roller down there. Don't miss the opportunity to really work to try to draw fluid flow around this large joint, right? So again, if you keep your knee soft and you use your foot and you start gliding, we can begin to explore. Now, before we start exploring, as you are doing your gliding, if you feel like your leg is going to spontaneously combust, it's so painful, I want you to understand that this roller is an inanimate object. It cannot hurt you, but you can hurt you. So how do you learn to maintain tolerable pressure? Look at this. I could take my whole leg off the roller. I could take all the weight of my leg off the roller just by keeping my toes on the ground. I can be very ginger with my knees. So right now I have maybe 5 pounds of the 30 pounds of weight of my leg on the roller right now. And it's just from me using my toes. And then once I get the glide going and I feel like I've found enough tolerable pressure, I'm creating it, then I could maybe let my shoulder and my hip relax and let my legs sink in a little more. And you'll start to find that if you control the pressure and get deep as you go with the glide, it'll hurt you less. There's the preparation of those sensory nerves. We want to ease back the worry and tension of the body. We're doing something good. Once I have that, I'm exploring by turning my toes a little down to the floor and getting just a little bit more into the front of my thigh. Instead of rolling my thighs over on the top of my thighs over a roller. Again, I see a couple ladies all the time doing this on Instagram now. Not doing very much for you. Slow down, find your compression, meet an area that feels sensitive. I've got one right here. I'm going to get smaller. I'm going to meet that pressure, and I'm going to find a place where I feel I could actually bend my knee, keeping the pressure constant, and then straightening out my leg. Now, again, if you have knee issues, really important here, keep your ankle a little flexed. It'll help to track the knee more appropriately through the socket, right? So when we have weakness in our hips, that knee doesn't slide back, and that's, again, another thing we're going to talk about when we do inner thigh lift, one of the neurostrength techniques I'm going to teach you today. Now, you could also do our direct shearing. Remember what we did in the calf? We could roll our body part over the roller. So again, I'm sort of pinning the skin and creating a rolling motion by just lifting and lowering my leg. Or I could set my toes to the ground. I would also encourage you to put your hand on your roller, pin the skin, and create the twisting action, which is cross friction. I'm pinning the skin, and I'm just hip flexing. Yeah, can you see where my hip is going, right? It's going up and down, right? So I'm pinning the skin. I'm not rubbing my skin up against the roller, pinning the skin and twisting it. And then I'm just going to pause there and wait. I'm going to give the tissue a moment to adapt. And then you would just perform that exact same thing moving up. So let's just pick one more spot today. So let's just come up just a sliver, right? So as you see how much I rolled it, barely at all. I maybe have 3 fingers between my knee and the roller now. Same thing. I'm going to go forward. I'm going to feel more top of the roller. My knee is soft. I'm going to come back. I'm going to think about pressing my thigh a little bit more into the curved side of the roller. If you get precise in just a few minutes, you can aid in improving your knee stability, your knee mobility, and diminish knee pain. So again, as we glide, we're looking for an area that feels sensitive. If you're like Sue, the whole thing is sensitive. Remember, you could always keep your toes on the ground, lighten up the body weight a little bit, and see if you can explore it again. And then again, just ease the weight back in. See if you can find an area where you can tolerate compression, and then bend and straighten the knee. And I would have you do this 3 or 4 times. Now, don't bend your knees so far that you feel like the muscle repels from the roller. Remember, we're trying to pin the muscle and make it contract. That's what creates that shear effect. Or I could do the direct shear. I could go from skin to bone. I could roll my body part over the roller. Or I could set my toes down, pin the skin. Again, I could even hold on to the roller to really perfect the technique. And I could twist the flesh around the thigh bone. And then same thing, we're just going to allow the tissue to adapt. Now there's a similar effect onto the side of the leg, onto outer thigh gliding and shearing. We're not going to do it here, but it is in a number of the videos to perfect that one. So let's go ahead and flip on over to the other side and let's work on the opposite leg, okay? So same thing, I'm going to come into a nice perfect side lying pose, right? I'm not leaning forward, I'm on my side. I'm going to take my roller and I'm going to angle the head of it away from me so it's more like a V, so that as I walk my leg out into a comfortable angle, I'm going to almost feel like it's right on the side of your knee, literally on the knee joint itself when you first start, okay? Because you're not going to come back to this perfect side lying pose once you get started. But what I want you to see is that the roller and your thigh are in a plus sign. So try to change the angle as much as you need to until that's what you see. Rest your head down, and again, we're going to fall forward. We're going to pause here. We're going to think about the pressure being on the top of the roller, and then using our hand and the foot, we're just going to push ourselves part of the way back so that we're feeling like we're pushing our thigh into just the top of the curved side of the roller. Okay? So here we go. We're going forward a little. We're coming back a little. Some things to really think about right now. Is one of the inner thighs more tender than the other? Are you noticing that on one side you were like, wow, it was really intense, and on one side you're like, maybe I'm in the wrong position, I don't feel it. Don't think you're in the wrong position. It probably is just that one side you have a lot more load coming down, causing a lot of that stiffening in the knee, and on the other side not so much, right? So again, as I turn my toes down to the floor and I explore more the front of my thigh, but then I want to come back to the inner thigh. And again, I'm going to find that area that feels a little sensitive. You need to take some time to glide, right? Allow the tissue time to adapt. As you continue to glide, it will adapt, and you'll feel the sensitivity probably increase as it does. And then once you get to that depth where you really feel like you can make some contraction and change, again, keeping your ankle flexed to support the knee and the knee angle. You're going to go ahead and gently bend and straighten your knee a few times. Or you're going to keep your knee soft, and we're going to lift and lower the leg. Or we're going to set our toes down, we're going to pin the skin, and we're going to do that twisting action. And again, you can just hold on to the roller to help you really perfect that twisting. And then same thing, I'm just going to let my knee stay soft. I'm going to let the weight of my leg sink in a little bit more. Even notice after you do the glide and the shear, you might actually feel like, wow, I think the roller is sinking deeper into my tissues. And that's what it is. You're pulling fluids away right now as you compress. But now when we let it go and we change the position, you're going to slowly get that fill effect in the tissue. Okay, so here we go. One more time. So I'm just a little bit higher, and we're going to start gliding. When you do this on your own and you're practicing even with the Melt on Demand videos, really start noticing, do you have one inner thigh that feels more sensitive closer to the knee and one inner thigh that feels much closer as you move to the hip, right? Now again, turn your toes down to the floor a little bit, keeping that knee soft. Look at how my whole body is coming with it. I'm using my hand. I'm not disjointing my body. I'm letting my whole body come through the motion. Be specific. Again, find a spot that you want to work on that feels a little sensitive. I've definitely got one. Remember, don't keep breaking over it. Just meet that area of sensitivity. And then nice and slow, we're going to bend and straighten our knee. Nice and slow. Go through the full range if you can. And then keeping your knee soft. Again, we can roll the thigh over the roller. or we could set our toes down, pin the skin, and create the twisting action. And we would want to do these types of techniques all around the knee. We have techniques on the front thigh, on the lower outer thigh, on the upper outer thigh. We don't do any shearing against the iliotibial band. We're more on the hamstring tendon in the lower part. And then same thing, I'm waiting. Okay, so those two techniques by themselves are super powerful. I'm going to see if there's any questions before we talk about the lengthening techniques and see if I can get you guys to perfect one of the very important ones is hip to heel press, but not so much less as bent knee press, drawbridge. There's so many great techniques to help aid in better knee mobility. But let's see if we have any questions here. I have no idea what that webcam thing is, but that's just bizarre and offensive. Teresa, so she's dealing with a Baker's cyst, so anything to help would be great. That calf glide and shear is super critical. So important in this next one that I'm going to teach you. This whole thing is all for you. A Baker's cyst, again, you've got too much strain on the back of the leg. A lot of people that have a Baker's cyst have hyperextension in the knee when they're standing, and that's weakness. And Netta, you know, when they say, is it possible to rebuild lost cartilage? No, but I tell you what, in my knee, you know, if I got an MRI today, I will guarantee that those tears would not be seen, because what I did was I stopped taking the torsion and strain away from my knee, from my weak hip. And as I started to come to an understanding of how to stabilize the knee, I stopped pulling on that tissue. And as it got more stable, I think that scar tissue and just myofibroblast just came and repaired the tissue around it and got my knee back on track. So I just feel like I would keep it. Deb says sugar is poison and it causes inflammation. Inflammation is what it is. That's what causes all the problems overall. Carrie had talked about that she melted her feet every day. She had chronic low back pain, and it really helped her. And same thing with me. I mean, it was really just melting daily really changed it. Lion, you're saying my knees are so stiff it's hard for me to move. This includes getting up and down from the floor and going up and down stairs. You can do this all on your bed, by the way, and that's a great place to start, so I would encourage that. Okay, so let's talk about another technique, which is hip to heel press and rotate. Now, if you really have trouble with getting on the floor or you have trouble extending your knees, I would actually encourage you to use the Melt Half Roller flat side up. Now, we would, if we were using the curved side of the roller, we would do some other techniques to prepare the pelvis and hydrate more, but we've done a little bit of movement, so we're going to just kind of carry the movements and again, just show you a technique. So when you're working on the roller, whether it's the curved side or the flat side, what you just want to make sure of is that the weight of your pelvis is on top of the roller, that the roller is not in your low back. So if I put my hands on my hip bones like I have a New York City attitude, there's no roller here. Okay, so I've got it in the wide surface of the back of my pelvis is what's resting on the roller. So the actual technique of hip to heel press looks just like this. I would kick my leg out low and long, and ultimately I want to try to bring my leg up. Now, let's just use this as an assessment, okay? Let's use a lengthening technique as an assessment. All I want you to do is bring your thigh where it looks like it's relatively perpendicular to the roller. Your knee is bent. Put your hand on the front of your thigh because that's not allowed to change in its position. Flex your foot and really slowly try to straighten out your knee 100%. And if you've gotten to about here and your knee is soft, and if you're not sure if it is, start videotaping yourself. I don't know. Can you still hear me now? I forgot to put my phone on airplane mode. Tell me that you can still hear me. I'm going to wait for 1 second to hear that somebody can hear me. And if you can't hear me, you can hear me. Thank you. Thank you. Yeah, sorry about that. My one friend always calls me if I don't turn on that airplane mode. Okay, so that's our assessment on one side, right? So we bring our thigh up and we try to straighten our leg. I'm going to do that 3 times and just notice what it feels like. Okay, and then I want you to go on the other side. You're going to put your thigh 90 degrees and we're going to flex and extend. And again, you're going to notice if the knee straightens out fully or not. Okay, so do that twice on both sides for me. I'm just going to make sure that you guys aren't saying something that is going to worry me. Yes, I can hear you. Thank you. Okay. All right, perfect. Thank you. Always a worry. Okay, so we've just done an assessment, right? We've just evaluated our range of motion right now. What does it feel like? Do you find that one side feels like it has more tension, or do you have one side that you feel like you cannot straighten out fully? You want to know that ahead of time. Now, what's great about using the resistant band is that for those of you that when your thigh was 90 degrees and you came up, your knee was bent, well, we can't do the treatment there. And for a lot of us that have knee problems, this is what we want to do. And even if you don't have knee problems, I love doing it this way. So again, perfecting this move. You're going to take your resistant band. I got a little Melt logo on mine. I'm going to go ahead and cover the sole of my foot. And what I want you to see is that my toes do not have the band. My toes are free of the band. Once you've got the band here, you're going to close the band up right above your knee. And then what I like doing is just making a nice soft handle with the band right above my knee with my knee bent. All right, now once I'm here, I'm going to keep my ankle flexed and I'm going to kick my leg out low and long, and then I'm going to pull the band into my belly and I'm going to stop here. All right, so now a couple of things. I want you to think I'm working on my right leg. My right ankle is flexed. My left foot is light on the floor. I want you to think about keeping your pelvis right on top of this roller. So there's no tucking or flattening the low back. I really want you to feel like that roller is staying flat right against the pelvis, okay? So now once I'm here, nice and slow, I'm going to start bringing my leg up, and I'm going to stop if I have a knee problem before my knee wants to bend. So if the angle is here and you feel like you start coming up and your knee gets loose, don't go that far. You just keep it where it is, okay? So whatever that range is, I still have the band in my hand. I'm going to take my opposite hand, my left hand, I'm going to grab up onto the band somewhere around my knee, and in equal timing, listen to this, I'm going to start flexing my foot. And then I'm really going to think about sinking the back of my pelvis into the roller, and I'm going to pull on that band. I'm just going to pull it on down. Now, if I've done that right, what I'm getting is a sensation of a tensional pull all the way from my heel all the way down to my hip. If that's not what you're feeling, you're only feeling it in one spot, change your angle, soften the knee, flex the foot, straighten the knee, sink the back of the pelvis again. See if you can find the angle of your leg where you feel a consistent tensional pull down the back of the thigh. Once you have it, I'm just going to invite you guys today to do external rotation with the leg and see if you can keep your ankle flexed, and then come back to neutral. And what I want you to see if you can feel is as you externally rotate, the tensional pull should translate more to the outside of the thigh, and then come back to neutral. You're going to do it one more time. Externally rotate. Now keep the external rotation and just bring the leg slightly across the midline. Classic. Slightly across my midline. And once I'm here, I'm just giving it a pull. And I'm just holding it there. And what you should feel is just an intense pull all the way down the side of your leg. Wait there for a moment. Flex that foot. And then bring your leg back to the midline. And then let it go and set your foot down to the ground. Now, if we've done what we want, you should feel a heat that is literally being generated down into your shin. If you're feeling it down into the shin, you feel it behind the knee, amazing, because that's new blood flow into a region of the leg that is significantly related to knee pain. And again, there's shin techniques, all sorts of stuff, okay? So we're gonna try this one more time. So same thing, you're gonna take your band, you're gonna bring it over the sole of your foot, you're going to take the band, again, right above the knee. You're going to crumble up the band, make a loose handle, and you're going to kick that leg out low and long, okay? Again, start here. Hold the band into the belly. Keep your ankle flexed. And nice and slow, you're going to bring that leg up. And again, you've got to stop and pay attention. That knee cannot bend at all. It needs to stay straight. Again, my right foot is light. My left ankle is flexed. And I'm thinking about sinking the back of my pelvis atop the roller as my heel is energized toward the sky. Once I'm here, again, I'm going to create my external rotation, and then I'm going to come back to the middle. Hi, Baron. I'm going to do it again. External rotation, and then back to neutral, right? Knee is staying straight, right, guys? Ankle is staying flexed. Don't let that ankle change. External rotation, and then back to neutral. Okay, so now this time you're going to take that external rotation. And again, you're just going to bring that leg slightly across the midline, but your right foot, I want you to think about bringing the knee a little bit toward the midline also, almost like you're kind of squeezing your legs like if you had to go to the bathroom or something. So you're kind of bringing those legs together. And then same thing, give the band a tensional pull, flexing the foot, sinking the back of that pelvis, really holding that tension. And then bringing the leg back to the middle and then letting it go. Again, noticing that blood flow exchange into the compartment of your knee. Now just doing that, keeping your knee here, I want you to, again, bend and straighten your knee. And just notice if you have better range, if it's easier for you to move through that, and if you feel changes in just one session, imagine as you started to continue to do this, what types of changes you would make, right? So if I feel less grindiness, less crunchiness in my knee, again, lots of fluid flow changes. For some people, we can make an instant change. Some of us, it's going to take a little bit of time. All right, one last technique that I want to share with you guys is a NeuroStrength technique. It's called inner thigh lift. And this one for me was one of the culprits of my knee problems, that once I really identified that my medial adductor on my right leg was really faulty, I fixed that and now I don't have knee pain. So what I'm going to do is put the roller out ahead of me, and very similar to what we did when we did inner thigh lift, I'm in a perfect side lying pose. Thank you, Baron. And then I'm going to bring the arch of my foot on top of the roller, and without rolling my body forward like I did with inner thigh lift, I'm just going to drop, I'm going to roll the roller back and I'm going to drop my knee onto the roller. Now this technique has a lot of nuances to it, and we don't have a ton of time for this, but some really key integral parts of this is thinking that your tail sort of swaggers back as if you're trying to find a little curve in your lumbar spine. So just try that with me. Tuck your pelvis, get your back flat, and then just try to release the low back. Just bring your pubic bone as if you're trying to energize it towards your foot. Then I want you to think about taking your top hip and just stacking it on top of the bottom hip. So if we do this correctly, you'll feel like your waistline lifts a little bit from the floor. And then once you're here, I would just encourage you to think about rolling the roller forward about 1 inch, but as you do, think about your hip traveling away from the thigh. So I almost want you to feel like it's opening up the front of the hip. So I've got a little tilt that's going to close the hip joint. I'm going to stack it, and then I'm going to think about rolling my top hip back. Once I'm there, nice and slow, I'm going to lift this bottom leg up. Now there's a huge tutorial on Melt about this, but what I want you to gain a sense of, if you've brought your leg up with me, is to really challenge this activation of your inner thigh today. So you're going to take your top hand, you're going to put it down onto the roller. I want you to kick your bottom leg forward as if you're kicking your shin into the roller, and then I want you to lift the leg up again. And then just wait here for me. Think about pushing into the roller with your hand and lightening the weight of your shin on the roller. It's an idea more than a thing. I'm just lightening up the weight so I'm not pushing into my top leg to lift, and I'm holding that leg up a little higher, and I'm just going to hold here for about 10 seconds. Just reintegrating the timing of those, of the deep stabilization mechanisms of my neurocore. Sounds fancy, but that's what we're doing. So I'm relaxing my top leg onto the roller, and now I'm just going to try to lift that leg up another inch. And if your leg is shaking, you are reintegrating. This is what we're looking for. You're going to bring the leg halfway down to the floor, about parallel to your roller, and you're going to pause. Without losing the waistline, the extension of this hip, I'm going to try again to lift this leg up and pause. Get this wonderful shake in my leg today. And then bringing it back down just a little bit, I'm going to pause. I'm going to do that 2 more times. I'm lifting up the leg with such specificity. And then I'm bringing it down, and 1 more time. We're just going to reintegrate today, lifting and pausing, and then bringing the leg all of the way down. Now listen, if you did that and you felt that all through your inner thigh, you are in the right pathway. If you're feeling it in your shoulder, your low back, down into the knee, wrong pathway. We would want to set you up with a little more specificity, and that's what you'll learn on Melt on Demand. But for now, let's flip over and just assess the other side. So the nice thing about neurological reintegration is if you have a hard time reintegrating, you'll know it, because it's almost impossible for you to lift your leg up properly, and you'll feel it everywhere except your inner thigh. right, so let's try this one more time together. So we're lying on our side, perfect side lying. I'm going to take the arch of my foot and then roll the roller back to me so that my knee gets onto the roller. Again, I don't want to fall forward when I do this. If anything, I could lift up my bottom hip and scoop it under a little bit so that I'm feeling more like I'm lying on the outside of my thigh rather than that bony prominence of my hip, which is, again, what we do to refine this is to tilt my tail back a little, stack my top hip over my bottom hip, and then I think about rolling my top hip back as my knee energizes forward. All right, so it's just an idea. Once I'm here, again, nice and slowly, without my waistline changing, I'm going to slowly lift my leg from the floor, and I'm going to pause. My top hand is going to come to the top of my roller. I'm going to kick my bottom shin forward, and then in that angle, I'm going to try to lift this leg up a little bit higher. Notice if you're sickling your ankle or doing anything weird with the foot, foot is just nice and relaxed, toes are pointing straight ahead. Once I'm here, still working to reintegrate with a solid held position. That's the secret of reintegration, is the non-action. I'm going to push into my hand. I'm going to think about lightening my shin from the top of the roller, and then I'm going to try to lift my bottom thigh up more, and I'm going to hold it here. And then once I've got it here, again, about 10 seconds, you just let your arm relax and let that top thigh relax, but still hold that leg up with the same activation, checking in, still energizing your top hip atop the bottom. We're going to bring your leg just part of the way down. We're going to pause. And again, we're going to nice and slowly lift that leg back up, getting precise to see if we can get the neural timing back to the neural core. Bringing that leg down, we're going to pause. And then again, we're going to lift the leg back up and we're going to pause. We're going to come back down. We're going to pause, right? Never taking a break here. All the way up and pause so my foot's never gotten to the ground. One more time, we're coming down. And then nice and slow, we're coming back up again. And we're just going to hold it here. 3, 2, 1. And then release it all the way down. Again, if you're finding that activation through the inner thigh, all the way up through the inner thigh, you're in the right pathway and you're probably in the right position. Tricky move, but one that you want to perfect. Okay, in the Melt on Demand collection on knee pain, you're going to find the side leg lift, the inner thigh lift, clams, all of these really important neurostrength techniques to reestablish the pelvic stability that is required so that as we go through gait, if our medial hip and lateral hip is unstable, if it doesn't have the dynamic timing through gait, your femur is going to spin and you're going to start getting rotation in the knee. And that's, again, what happens with people who can't straighten out their knee. Now, even for what we did, you could put your your calf back on the roller and just notice if now you get more range of motion. Right? Just notice if suddenly it's like, oh, I actually think I can straighten my knee a little bit more than I did when we started this out. Notice if it's different on one side or the other. You could also lie back onto your back and you could tune into the masses and spaces. Now, we didn't do anything for your upper body, but some of you guys, if you hydrate the legs, you might notice that your torso is more relaxed on the ground than when you started. You might notice that the arch of the back is more spacious, but the lift is below the belly button rather than above. You have less of that tension in the low back, and it's now just a nice, small, distinctive space. Perhaps the butt cheeks have settled to the ground. Maybe you feel more evenly weighted here. And if you feel the back of your thighs have settled to the ground at all, again, we didn't really do anything specific to psoas today, but we did work through the rooted core from the inner thigh. It was, again, just my choice to pick that one move. The foot treatment is so critical to knee problems, and so learning how to treat your knees using just one ball, and you can find that also on Melt on Demand, but also on Instagram and Facebook. I do the foot treatments all of the time. I think last week or 2 weeks ago when my friends came into town, I was wearing a pair of wedges, and so I melted my feet before I went. So easy techniques to learn, and it's just one ball treating the bottom of your foot will help you with gait, will help you with the ankle mobility, which will reduce the strain and the torsion on the knee, right? So when our knee bends, the femur has to slide over the tibial plateau. And so if there isn't good stability, it gets stuck. And that's why when you go to walk upstairs, your femur is getting pushed into the patella, that bone onto the top of your knee, and we need that thing to slide and glide. So again, lots of other techniques that you can learn on Melt on Demand. I just picked some of the top ones that to me are insanely critical to master, and it is important to learn how to do it. Let's see if there's any other questions that have come up. Yeah, I don't know what she was asking. Cracking, yes, when no joint should make any audible sound. So if you're feeling clicking, cracking, snapping, popping, thunking, crunching, anything like that, we know that we have poor tracking in the knee. And again, the knee is a large joint, and there's a lot of movement, a lot of gaseous exchange that happens because there's a lot of space in the compartment. Even where your meniscus is, you've got a circular one and a moon-shaped one, and there's liquid sitting inside of this capsule that is allowing a little bit of pumping and expression of movement. Right? So there's a lot of space in the knee that we want to maintain, and that's what we lose. So for sure, the cracking is what you'll alleviate. I mean, that's what happened to me. My knees used to sound like popcorn, and they don't make a sound anymore. Let's see. Chantal, she says, I do melt a lot, but my quads seem to always be tight. I can't remember which on-demand one I did, but maybe tomorrow I'll go on Instagram, Chantel, for you, and I will demonstrate front thigh gliding and shearing, because there's a secret to that one too. And if you can master that one, quadriceps are definitely a precarious muscle because the tibial tendon is part of the quadriceps. They call it quadriceps tendon, tibial tendon, that is actually encasing your patella. And so when we straighten our leg, that patella has to move. It's got to slide and glide over the joint. And if it doesn't, we have all sorts of problems. So maybe tomorrow I can show you that one. Easy enough. Let's see what else. Definitely water is huge. And Jackie is asking, is there, she has issues with her psoas and iliacus, and is there a connection to knees and tight hips? 100%. I'm telling you guys, when my knees were the worst, when I started to recognize the instability that I had in my pelvis, that was really the thing that was never addressed when I was younger, that my hips were unstable, and so I was spraining my ankle, I messed up my knee, all of these things were happening, and it really had a lot to do with the pelvic control. So the techniques I've taught you here, I know it seems very far away from your pelvis, but your big toe and your pelvis, that lateral hip, are like best friends. And so if you have a bunion, you know that you've got lateral hip instability. If your feet pronate substantially, that's also a bit of a hip issue. So where we don't just jump into strengthening the pelvis, because if all you do is start loading the body, you can very quickly become a stronger, more dysfunctional body. You get better at managing the imbalances that you have in your pelvis, but you actually never address them. So what we want to do is hydrate the tissue, get the neural reception back in so that the sensory system is a little bit more active, allowing that pelvic floor to wake up a little bit. And then after we've done some calf and some inner thigh and even back thigh, that's a huge one, rinsing that through, working on hip to heel press, rotate, and cross. Again, you're going to see all of these techniques in that collection on Melt on Demand. And if you follow along with the plan over the course of those videos, you'll learn all of the techniques that you need to. There's refined categories, super important. And then again, then you would start engaging in the lower body stability sequence from Melt Performance, where you really learn how to reestablish the pelvic stability. But again, don't do the reintegration before you do rehydration. The way that the R's work: reconnect, rebalance, rehydrate, release, reintegrate, repattern, and then you can rebuild your body. So if you work in the process and you really take the time, really dedicate yourself to caring for your body in a new way, you'll see the transformation. Again, my knees were supposed to have surgery at 23. 52, I don't have knee surgery, and I never look back. So if I can help you to avoid those knee surgeries and reestablish the stability where you haven't really tried to regain it, that's really the most important thing. I saw one more question from Verandia, Verandiana. Beautiful name. I'm not sure how to say it, but she says that she feels better. She had an MCL tear, so a medial collateral ligament tear, and sometimes I don't know what treatments I have to do to avoid, problems. Any recommendations? What I just taught you today, I want you to get a handle on those techniques. Medial collateral ligament, that was one of the ones when they had the MRI, I had the tears in my meniscus, and he's like, you have a strain on that medial collateral ligament that's looking a little feathery, so we might want to go in there and clean that up, and maybe we'll do some stitching on it. And I was like, this all sounds terrible, right? And I repaired this without anything. I wore a splint on my leg for months and strengthened it every day and hydrated it every day and just took care of it. And over the course of 6 months, it got better and better and better, and I didn't use the splint anymore. And again, I'm 30 years into this and I feel great. So, these are things that you can do for yourself. So if this intrigued you, make sure that you like the video, subscribe to this channel, and again, go over to Melt Method. We've got a brand new platform for Melt on Demand coming in about a month from now. So live classes on our streaming platform. Super, super excited to be able to hone in on some specific techniques and start doing classes specific to what you guys are needing. And remember, if you have any questions or comments, leave them in the comment box so that we can continue to help you guys through either the YouTube channel, Instagram. We're on Melt Method at Instagram, Melt Method on Facebook, Melt Method on TikTok. And we're here as well. So thank you guys so much. Hey, quick thing, remember, sip water frequently, right? That's the secret of hydration. Sip water frequently, eat water-filled foods more often than you do all this refined foods. And do me a favor today. Call one person that you love and put some positive vibes out into the world, because if you do that, I'm telling you, it'll elevate the frequency of you and everything else around you. I'll feel it too. So I really appreciate that. I hope you guys are all doing great and you enjoyed this session. Again, I'll see you all soon. Happy melting.